So you don't like my light?
You need some LED lights.
Some LED light, right? Because I think the ones that I have here are that supposed to be natural, but they're too bright.
They're too yellow.
Yeah, maybe I'll just take some of them out. How about that? How's that?
Now it just looks like a deeper shade of yellow.
Maybe I'm yellow. Maybe I've got a little jaundice in me. Better?
You should get that checked out.
The jaundice thing? All right. So let's play that thing. And you do want me to change it at some point, huh?
The light?
The video.
Oh no, I like the video.
All right, so let's get started. All right, one more episode number 3. Cool.
Welcome.
Welcome. Right, all these people. Hello. I hope everybody is enjoying their Tuesday evening. I'm Ryan O'Neill Williams, your host, and my special guest, as ever, on the brainstorm is Dr. Symeon Missios. You know, we've been working together for almost a year now. And you just corrected me about your name.
It was time.
It was time. You're like, you're not going to call me that again. You know how much I do not enjoy people calling me Brian? I can't stand that. So how did you wait this long? Too nice.
I thought you were going to change the fonts, make your name as big as mine. What happened?
Oh, I told you I wasn't going to do that. That's just silly. I'm just a host. It's just a whole different thing. For those other people who actually want to, do this kind of thing with us or whatever, I want them to be able to get their names in and that sort of thing. Same size, nice big size. All right. So today we're going to talk about neck pain, right?
You're the boss.
That's right. Thank you. That's right. I'm the boss.
I'm just here to provide advice that is not to be used for medical purposes.
Right. Not for medical purposes, but at the same time, it is from a neurosurgeon. It is the information that is coming from someone who has done this. Hey, you know what? I've never asked you. Why did you decide to go into neurosurgery?
Yeah, that's the standard interview question.
Yeah.
We get asked. We had to write an essay about it too.
Yeah.
It's just like every decision in life, it's a multitude of factors. I don't have a dramatic event that kind of made me decide this, but going through medical school, you go through different topics and you study the entire human body and physiology and anatomy, and the brain and the nervous system have always been the most interesting ones to me, especially because it's still uncharted territory to a certain degree.
Mm-hmm.
So that's very interesting. And then the procedures that we do have always interested me. And we're dealing with something that we don't entirely understand. And, to some people, that's a huge turnoff. Some people find that very exciting.
Yeah.
It's like a bunch of people in the Stone Age that discover an airplane, and we're just trying to figure out how it works, but we don't have a full understanding.
Yeah. Not even sure you've got all the pieces. Like, there's an understanding of things that doesn't even make any sense to you whatsoever.
Yeah.
Do you have to? I figure all doctors or all surgeons would have to have steady hands, but do you feel like you have to have even more so than anybody else, any other kind of surgeon?
I mean, the procedures you do, especially some of them, especially under the microscope, they are technically very demanding.
Mm-hmm.
Of course, a lot of other surgical subspecialties are technically demanding. Like I'm sure cardiac surgeons, what they do can be very technically demanding. Urologists a lot of times use like special surgical robots, and those are technically demanding. So I mean, I can't compare it to other surgical subspecialties.
Okay.
But yes, some procedures can be certainly very technically demanding.
Okay. Anything recent, and specifically anything with any neck pain or neck injuries you've dealt with recently?
Since that's the topic of our current episode.
Hey, that's what I do. The segue, man. That's what I do.
No, we'll talk about it, but neck, the neck is part of the spine.
Yeah.
Which is part of neurosurgery. It's brain, spine, and peripheral nerves.
Right.
And it's a very common problem, as we're going to talk about.
Mm-hmm.
And recently, this will make a lot more sense at the end of the episode. But recently, we had a case of a patient who presented with he fell. And since he fell, he developed weakness of the left arm and left leg.
Okay.
And the reason for the weakness was that he was having compression of the nerves of his neck. And he required surgery, and the kind of surgery that we're also going to talk about in this episode. And following the surgery, there's actually an immediate benefit. So that's always very satisfying.
Okay. Right, because then they can right away feel the effects, or not feel the effects anymore. So yeah, that definitely works out. I mean, my number one thing that I have with my neck is I'll sleep funny on it. I'll have one too many pillows or one too few pillows, and when I wake up in the morning, sometimes the neck will be out, and there's some nights where it's perfect, like I've got it just right, you know what I mean? But then there's sometimes you roll over in the middle of the night and you don't even realize it, and then when you wake up, like, not only are you feeling it here in your neck, but then you'll feel it in your arm. You might even feel it in your leg. Is it because all of those areas are connected? I mean, everything is connected to your brain / neck, technically, all the nerves in your body, right? But why does it normally seem to, neck and arm and or leg pain seem to go hand in hand?
So that's a good question. I think to answer your question, why sometimes you wake up and your neck is hurting, I think part of that is because we're all getting older.
Thank you.
And things wear down. Okay. Yeah. And we have to kind of go back and think of the normal spine.
Mm-hmm.
And then just try to figure out where the pain is coming from. And it sounds really silly and trivial, and something that we should know. We should very easily be able to pinpoint where the pain is coming from, but not always. And that's sort of half the battle, is trying to figure out where the pain is coming from. Because depending where it is coming from, the treatment can be very, very different. Okay. So I'm going to actually share my screen.
Cool.
And let me know if you can see this.
Go ahead. All right. Yeah. And there you go.
So this is a picture of or a drawing of a normal spine and a normal anatomy. So right. This is a person who is standing, looking over to the left side of the screen. And that's the front of the neck here. The back is over to the right side. And you can see the spine is made up of bones,
right,
which we call vertebra.
Mm-hmm.
In between the bones, you have the discs, and you can think of the discs are springs, so they're soft, elastic. They bear the weight of the head, and you can think of them like the suspension system for the spine.
Okay.
Inside the spine, which you cannot clearly see here, is the spinal cord, and there is a ring made out of bone that protects the spinal cord.
Right.
And
Which
then
is exactly why it's kind of in that sheath, and why we can't see it, because the bones are there to protect it, right?
exactly.
Mm-hmm.
And then the spine, then the nerves come out of the spine at each level. You can see them here in yellow. They come out through these bony tunnels, which we call the foramina. And these nerves don't end here. They go all the way down. In the case of the neck, they go to the shoulder, they go down the arms, they go to the hands, they go to the fingers. So if one took a camera and looked up this opening here,
mm-hmm.
it would look like this. So again, just to orient people, this on the top is the front of the neck.
Right.
On the bottom is the back of the neck.
Okay.
And then you have the right side and the left side.
Right.
And what you're looking at here, so someone's throat would be on the top.
Right.
So what you're looking at is you can see a slice through the disc, and you can see that the disc has a sort of a ring around it that's really tough and leathery.
Right.
And the inside is soft and spongy, and that's the part that absorbs all the impact.
Right.
You can see all the bones here, and then you can see the spinal cord in the middle, and then the nerves come out, and these are the bony tunnels that we spoke about.
Okay.
Through which the nerves come out.
So this is a cross section. We're looking at it from the top. What are those two, the two holes that are on either side there? What runs through those? Because I'm sure that's what something's going through them. That's why the body is set up like that, right?
Exactly. So the holes here are called the vertebral foramina. What runs through here is a big blood vessel called the vertebral artery, and we have two, one on each side.
Okay.
There are 4 main blood vessels that take the blood from the heart and send it to the brain.
Right.
There are 2 vertebral arteries, one on the right and one on the left, and 2 carotid arteries, which are further in the front. They would be kind of right up on the top of the screen. Okay. On the right and left.
So you know what you're saying to me right now. Not only are you in danger when you hurt your neck, not only are you in danger of hurting something that deals with your nerves or your brain or but you're also possibly hurting your blood vessels or your arteries that are running down the side of your neck. And that can be just as painful, or if not more so.
Yeah, it's not as common. But yes, you can definitely injure the blood vessels in your neck. Typically, it takes a significant amount of injury or trauma to do that.
Okay.
But you could injure the blood vessels in your neck, and that's the vascular injury is typically called a dissection.
Right.
It's not a common reason why people develop neck pain, but it's something to think about. If someone were to have a significant injury where they fracture different bones, it takes a lot of impact to fracture the bones, and certainly that impact can be transmitted into the blood vessel, so it can injure the blood vessel as well.
So you're talking about maybe a car accident or a sporting, like a bad sporting accident.
Absolutely.
Okay. All right. So okay.
And when you deal with blood vessels, an injury to the blood vessel can affect, blood vessels are like pipes, so there's blood flowing through them.
Right.
If you have an injury, it can affect the blood flow, and in this case, it can affect blood flow to the brain, which could result in a stroke.
Ooh, okay.
But that could be a topic for
For another time. We'll
yeah.
actually take up a stroke another time. So that's interesting. I mean, last week, for those of you who were paying attention, last week we spoke about uh, the Neuralink that Elon Musk is talking about, and so one of the things we were talking about was how you could connect that Neuralink and the implant from one side of the body to the other side, and if there were to be a break in those vertebrae right there, and you not necessarily have you either become a paraplegic or a quadriplegic, and then it would be an issue. But it's clear that that is a major issue with people's neck and back and whatever. What kind of the guy who you said the patient who you were taking care of last week, what were the first signs that he knew that there was something really wrong?
So the he had weakness of the left arm and left leg, and he had trouble walking. He had significant unsteadiness, which led to the fall to begin with, and then after he fell, the symptoms became even more pronounced.
So he wasn't having pain, he was just having weakness?
Right. So let's go back to that cross section, and let's talk a little bit more. So where could the pain be coming from? So, it could be coming from any component of the neck. So you have this cross section, but you gotta realize that there are muscles, especially in the back of the neck. So inflamed muscles are a very common reason for neck pain, and that's the kind of neck pain you get if you turn your head the wrong way, if you sleep on a pillow that you're not used to. Right. People that are drunk who pass out and they wake up, and their neck hurts. A lot of times it comes from muscles.
Okay.
What else is there? Well, the bones. So you could have bony degeneration. So as we get older, unfortunately, everything wears down.
Right.
So the discs can wear down.
Right.
And when that happens, there's less padding between the bones.
Right.
And that can be a source. So there's your suspension starts getting stiffer.
Exactly.
And as a result, the impact is not absorbed by the suspension, but it gets absorbed by the bones. It's like a car that you keep driving the car on a dirt road, you lose the suspension. Sooner or later, you're gonna have an issue with the body of the car or the axle or other parts of the car that I cannot really name.
Yeah. What works even better with that analogy is like your brake pads. You're constantly rubbing against them and wearing them down every time you hit the brake. So someone who is doing a repeated activity over and over and over again, one, because of the age, if you're 79 years old and you've been doing this your entire life, definitely it's going to happen. But if you're, say, for example, a swimmer who every time you go in the water, this is your action, right? Or some other activity that repeatedly is wearing down your shock absorbers / brake pads or whatever it is.
Right. So, people ask me often, why did I get this? Why do some people have more worn out spines than others?
Right.
And part of it is age.
Yeah.
Part of it is genetics. Neither of those things you can control,
right?
Because we're all getting older, and the genetics is sort of whatever hand you're dealt. And the other is activity. So repeated activity, like bad posture, looking down, all the time. People do it all the time. They don't even think about it.
Exactly.
And then certainly activities that have a lot of impact.
Yeah.
So, I once saw a gentleman who was not really that old. He was kind of late 50s, early 60s. His spine was completely worn down.
Wow.
He used to be a rodeo rider.
Oh.
I mean, you can imagine the
Yeah.
impact involved with
Yeah,
that.
it's
And
all that's happening all day. Every time he gets on one of those bulls or one of the horses, the stallion, he's going up and down all the time. He's gonna, wow. It's
mean,
if you think about it, it's like when you buy a new car and the suspension's so great that even when you run over Long Island potholes, you don't feel anything, right? But then after a few years, you're definitely gonna feel it. So was his were his bones basically rubbing against one another at that point?
well, he just had significant disc degeneration. So his discs were very, very thinned out, and as a result, that causes a lot of pain, and causes wearing down of the bones. Yes.
Okay.
But another thing we need to talk about is, we got sidetracked, but just to get back to your question, what else is there? Well, it's the nerves.
Okay.
And you can think of the nerves as two different big groups. One is the spinal cord, and the other are the nerves.
Is that indicated by the yellow?
The yellow.
Okay.
So the spinal cord is in the middle, and that's the main way your brain connects to the rest of your body.
Right.
So if something is pushing into the spinal cord, it doesn't necessarily cause pain, but it can affect strength because the motor nerves are running in the spinal cord.
Right. They're not receiving the messages that they should receive in the full strength. Okay.
Exactly. And it can affect feeling, sensation.
Right.
Because that runs through the spinal cord.
Right.
So people perceive any change in feeling as numbness, tingling, pins and needles sensation.
Right.
Burning. And that can be very painful too. I mean, when your foot is asleep and you're trying to walk on it, it's not very pleasant.
No.
And also the nerves that go to the bladder also run through the spinal cord. So people's urinary function can be affected.
Okay.
Now, if something is pushing into, and we call that the spinal cord compression, there's a medical term called myelopathy. If something is pushing into the nerves, then you get a lot of pain.
Right.
And you get pain in the distribution of the nerve. So if a nerve goes to the thumb, you can get pain that goes all the way down to the thumb. And you can also get weakness and numbness, but it's in the distribution of the nerve, and that has a different name medically. That's called the radiculopathy.
Okay.
So when we look at an MRI and when we ask a patient questions, that's how we classify the different syndromes.
Okay. So what can we do about any of this? I mean, are there treatments? I mean, they don't all have to be surgical, right? You probably have some treatments that wouldn't actually require an invasive treatment, but I guess we start there and then move up to the other stuff. Like, how do you deal with someone whose entire shock absorber has been worn down?
Right. So you're right. I mean, you don't start with offering surgery, especially if the symptoms have not been going on for so long. So, I mean, the first step when someone presents with these symptoms is to take a good picture of the neck.
Okay.
And nowadays, getting an MRI is so easy, and that's typically the first step because that allows you to try and figure out where the pain is coming from or where the symptoms are coming from. You can see the spinal cord very well. You can see the discs very well. You can see the nerves very well, and you can also assess the degree of compromise or involvement. For example, if you get an MRI and you see that the nerves, the spinal cord, they're completely free, that's a patient that needs physical therapy and non-surgical management. If you get an MRI and you see that someone's spinal cord is completely compressed and thinned out, then surgery is definitely recommended. But depending on the MRI, things that we recommend are, oh, there you
I
go.
found you one. I thought I'd go look for one. How about that?
Yeah, that's a very good looking MRI.
Okay.
Okay, so you can see the bones, and the dark lines between the bones, those are the discs.
Okay.
You can see that our spine, when it comes to the neck, has this curvature.
Right.
And we call that lordosis, and that's perfectly normal.
That's what should happen.
That's
Remember
what
we were talking about military neck the other day, and that's like when your neck is actually straight and then does not have the proper curve.
Right.
And that's a problem.
So because of repeated activity, some people's neck can be very straight.
Yeah.
That's not a natural position for the neck.
Right.
So it can wear the discs down more quickly, and then it causes people to hunch over.
Mm-hmm.
And that creates a number of problems as well. Behind the vertebral bodies and the discs, all that white that you see, it's the spinal fluid, and then you can no, that's actually the fat under the skin.
Okay.
Just behind, just right there.
Okay, good.
That's all spinal fluid, and you cannot see the spinal cord very well in this picture. Because of the way they have it, because of the way the slice is and the way the picture is taken. But essentially that shadow there, that's the spinal cord.
That one, okay, good. All right. Yeah, not a bad shot. I was looking at it, I say, okay, let me see if I find one, and look at that.
But what I was saying is that things that we normally recommend for people that present with symptoms are medicines. Those are the anti-inflammatory medications,
right?
Muscle relaxants. A lot of times a short course of steroids and prednisone can help significantly.
Okay.
Physical therapy can help. A lot of times patients see their chiropractor, that can help as well. And if the pain is very persistent and the MRI can help us identify the source of the pain, having someone see a pain specialist for consideration of a steroid injection, that a lot of times can offer benefit
and relief. Okay. But if it's really bad, at what point do we get to the point where we're like, we think we have to do surgery?
Let me show you a couple of more pictures here.
Oh, cool. You got some more.
So this is that same cross section that we were looking at.
Right.
And sometimes this can happen.
Ooh.
So, I mean, you would think that it takes a lot of force for something like that to happen.
Right.
But not always.
Mm-hmm.
And sometimes a piece of disc can bulge out or break off, and we call that herniation.
Right.
And if it breaks off towards the front, nothing, you don't feel any different. But if it breaks off towards the back, the spinal cord is right there.
Yeah.
So this compression of the spinal cord, if it becomes slowly, or if it happens slowly over time, then people may not have any symptoms until much later. But if it happens very quickly, people can develop symptoms acutely. And
Right.
in that patient that I was talking about, who presented with a weakness in his arm and in his leg, this is what happened. So he probably, he had symptoms, but then he fell and the symptoms became much worse.
Right.
So he probably had something going on here, but then the fall probably made it worse or bruised the spinal cord because there was no room here. And then he presented with an MRI picture that looked very, very much like this.
Right.
There's no medicine or physical therapy, unfortunately, that will make this picture any better.
No.
And your only option is to surgically create and make more room for the spinal cord.
Okay.
The other thing that can happen is this. So that's a very, very common finding, especially in people who are elderly. So this is what happens when a disc is worn down and thin, and the bones are much more inflamed. So any inflammation in the bone, it causes more bone to grow.
Okay.
And so if you break your arm,
yeah, it's trying to cover over in order to heal it. Mm-hmm.
Exactly. So if you break your arm, the bony edges become inflamed,
Right.
they grow more bone,
Right.
and you heal.
Right.
The body doesn't know when to activate inflammation, if there's a break or if there is arthritis in this case.
Right.
So you have here bone formation where you do not want bone, and the same thing can happen in the lower back too. But essentially, this over time, these bone spurs, which we call osteophytes, form. Mm-hmm. And over time, they can compress the spinal cord, they can compress the nerves. And remember, we said when the nerve is compressed, it can cause pain, numbness, tingling down the arm. And that's what this patient would typically present with.
And that's called stenosis, you said?
Stenosis is the narrowing. So there's narrowing of this opening. So that's called stenosis, yes. And also stenosis here, because the bony tunnel through which the nerve comes out is narrowed down. And looking at this is a sideways view. You can see this disc is nice and thick. This is thin. This disc is almost completely gone.
Wow.
And because this disc is gone, the bones here are closer to each other as opposed to here. So as the bones collapse on top of each other, this opening becomes smaller and it pinches the nerves. And that's what a pinched nerve is when it comes to the spine.
That's the pinched nerve. Okay. That's interesting. All right. So I did not realize that was what was it. I've heard about herniated discs all the time, but that I have never actually realized that that's what was actually happening. Speaking of which, let me show you one of those herniated discs that has happened to someone who is, like we said, in the sporting world or in the, you in a car accident, it could definitely happen. This guy's Jan Blachowicz, and he's a MMA fighter, and he's saying that's
a high impact activity.
Absolutely, right. And if you think about it, for an MMA guy, not only are you getting punched in the head and your neck is snapping back, but for MMA, you can literally be. The whole idea sometimes is to put their arm around your neck and make you go to sleep based on that. In fact, isn't that what they are doing technically in order to make you knock you out? How are they doing that? Is it the blood that's rushing through that they've stopped?
Yeah, I mean, just giving someone a chokehold, that can compress again the blood vessels in the neck.
Right.
So it decreases the amount of blood your brain sees.
Right.
and that can cause you to pass out.
Right. Right.
Sure.
All right. But he's saying he's got 3 herniated discs, and because of that, now he can't even feel his arm. It's like, and what's wild is he knew he had these hernias, and he was getting ready to do another fight,
Yeah.
and had to postpone it against Alexander Rakic. I think that's how it's pronounced, right? Alexander, it's easy. I think it's Rakic, right? And then so he's basically saying, I'm sorry, I won't be able to make the fight March 26th. Oh, this happened a while back, but because he has an injury in his spine around his neck area, so it's kind of hard to
I mean,
do.
the good thing is that this is something that's treatable.
Yeah.
And I'm sure if he got it treated, he would get the feeling back.
Okay.
The problem is, he cannot really continue playing this sport. If he doesn't have any surgery, then he's risking more nerve injury.
Right.
And if he does have surgery, you would put the surgery at risk if you keep getting beaten up like that on a regular basis.
I mean, it's this is the thing. Like, people think for some reason that you can keep on doing this kind of thing. This is really a difficult situation he's putting himself and his body into on a regular basis. But I guess that's part of what the whole gladiatorial experience is about, right? There's another gentleman here who had a similar issue to what your patient was talking about, because he said he fell and like his head almost separated from his body after falling off a chair. So literally, he was weak too. He was having an issue, and then he fell down, and then he's like, "Oh my gosh, my neck really hurts." This guy's a Marine, Royal Marine Wesley.
Yeah, that's keep scrolling down.
Okay. 7-year-old had been falling frequently and was taken to Ealing Hospital in West London. The blood test found a perilously high calcium count in his blood.
Keep going down. Sorry.
Okay. He later moved to St. Mary's Hospital in Paddington Central.
Close the ads for the love.
yeah, how about that? Wesley is now back on his feet following surgery. Recalls, "I was told my spine was very precarious."
This could be. This sounds like he had a fracture, so it's a little bit of a different situation.
Right.
So I don't know if that applies 100%. It's a horrible article because they don't give you any specific information. So
yeah, I think that they can't give you everything. I think to some extent, even though they have a conversation with the person, they still want to, protect them from whatever else is going on. Trauma Justice League. But he says, his colleagues went in and helped him with the situation. Well, the people at the NHS. It's a British article, so they're basically saying they had a situation they helped him out with that. I like how you laugh. The articles I choose, but you won't choose any. So next week you choose the articles, okay?
It's more entertaining to have.
It's more entertaining for me to do them. We were talking about.
What about this? Crying puppies pulled from house fire in Arizona.
Let's do that. Let's talk about that instead. Let's not. Why are we here talking about? Brain aneurysms and whatever. Let's just talk about puppies and kittens and all the fun things that we could do instead. But yeah, so how did your other gentleman's issue get resolved?
So let's
I'm going to stop sharing so you can show me again what you did. All right,
can you see this?
Yes, I can see it.
All right. So again, going back to this picture, the only way to remove the compression of the spinal cord is to physically do that, and that involves surgery.
Okay.
And similarly, if you had bone spurs all the way here, again, going in from the front of the neck through a very small incision allows you to clean all this surface. Now, to do that, you have to go through the disc. Remember, we said that there are two big arteries to the right and left, so we cannot really access that area surgically. But we can go through the disc, and in most cases, the disc is a very unhealthy disc, like here. So the surgery involves removing this disc, and then we can get to this back surface and remove any disc fragments or any bone spurs. Okay. Doing that frees up the spinal cord and the nerves, so immediately it fixes the problem.
Yeah, relieves that pressure and allows their nerves to actually work. Okay, ladies and gentlemen, it looks like we had a little bit of technical difficulty here. Not sure exactly what happened, but Doc, you were telling us about the surgery that fixed your patient's neck pain.
Yeah, let me go back to sharing the screen.
Okay, cool. Here we go.
So we were talking about how this compression can be removed, and we were saying how we enter from the front of the neck and we remove the disc.
Right.
And that allows us to remove any compression of the nerves and the spinal cord. Now, and we can achieve that through a small incision along the front of the neck.
In the front of their neck. Wow.
In the front of the neck, yeah. So, in the process of doing that, relieving the compression should make the symptoms better.
Okay.
But in the process of doing that, we are removing a disc. So that leaves an empty gap in the spine. And that gap has to be filled with something. Okay. So if we were to, look at the sideways of the spine, this is a schematic that shows the disc being removed, and then that leaves a gap. So that gap has to be filled with something, and in most cases, it gets filled with a special spacer. Think of it like putting a wedge in between the two bones. And the purpose of the spacer is twofold. One is to make sure the bones are separated,
right?
So they don't collapse again like they used to,
and have that nerve pinching, right?
Right, exactly. So if they're separated, you're not going to have the nerve pinching.
Right.
And the second purpose is that this wedge typically is either made from a material or contains material that will promote bone healing. Because eventually you want bone to grow across this space, and that's called a fusion. Because you take two bones, and once everything is said and done, you end up with one bigger bone.
Does that not mean that they lose some mobility though? Because the way it naturally is, that spongy, stuff in between sort of allows you to do all this stuff. And now you can't, because you've got a straight column of bone instead now.
That's a very good question. So, the cervical spine is made up of 7 bones, and there are joints and articulations. So there's a lot of flexibility. Right. Anytime you do fusion, you decrease that flexibility. Now, is this something that affects someone's life? So if someone is a professional athlete, or a gymnast, yes, it will affect, your ability to do these high performance physical activity tasks. Right. For most people in their day-to-day life, a 1 or a 2 level fusion will not significantly affect you. Okay.
Just means you gotta turn at your waist instead of at your neck.
No, it's nothing that bad. Nothing that severe.
And there's nothing else we could do, like put some sort of plastic rubbery thing in there or something else like that. I mean, you have to go with a bone graft.
So what you put in this space has changed across the years. when this procedure was first described, they used to take a piece of bone from your hip
Hmm.
and put it in your neck, and that's something that's very painful. So then they started looking for other material, synthetic material that you could make this graft out of
Hmm.
to implant it. So they use this synthetic material called PEEK, PEEK.
Okay.
They have grafts that are made out of titanium.
Ooh.
There's a lot of science that goes in this. Now, in order to promote this bony healing, you want to eliminate any movement between the bony edges and the graft. So to do that, we place a small plate. It's a very thin plate. You don't feel that it's there, but it locks the bones into place, and it's secured in place with screws right in the bone.
Wow.
And that's an example of a plate. There's different. The design is very similar from between companies, but that's an example of a plate. And you can see like the grafts here behind it,
Right.
and this plate goes to the front of the spine, and
What is
this
that made out of? Metal?
this is this is made out of titanium,
Wow.
so it's strong, and it doesn't oxidize, and more importantly, it is not ferromagnetic, so you can have MRIs afterwards, which is very
Uh,
important.
are you going to trigger every airport scanner when you have that in your
No,
back?
no, because airport scanners trigger
For the
metal
ferromagnetic.
that is
Okay.
magnetic, and titanium
Okay.
doesn't trigger.
Okay. Interesting. Very interesting.
So that's a common procedure. Now, every once in a while, let me just show you one more thing. Every once in a while, you have patients where the disc herniation is very lateral,
Okay.
and or sometimes you have patients and they have bone spurs, but they don't have it in front of the spinal cord, they have it behind the spinal cord.
Oh.
So back here along this surface.
Oh, okay.
So in that case, there's another procedure where you can go in from the back of the neck
Okay.
and dissect all the muscles that are attached to the back of the neck. And then you can remove an area of bone, whether it's here, or you can remove all these bony spike
Yeah.
and relieve the compression from the back of the spinal cord. So that's something else sometimes that we
What
have
they
to
can
do.
do. Let me ask you something, just in a general sense, how successful are these types of surgeries? Are you like, most times they're okay, and definitely people recover, right? Nobody is, say, going under and not waking up from something like this, are they?
Well, hopefully nothing that dramatic. How
Yeah.
successful it is, that's very open-ended question.
Yeah.
The degree of success depends on how carefully you select the patients. So it depends on who you offer this surgery to. If you do it for the right reason, it is very successful. It is very successful at eliminating the pain that comes from pinching of the nerves
Okay.
or the spinal cord. Um, and this is this can make a significant difference in someone's life, especially if they've been dealing with the symptoms for a long time.
I understand. I understand. All right, good. But yeah, if it works, and in the case of your patient, it did, right?
Yes, yeah,
Right.
yeah, we've had a very good results. So,
Right away, he was like, "Okay, I'm great. I can feel everything." And walked out of. Did he walk out of there right away, or
oh
you?
yeah, yeah, I mean, he walked out of the hospital. The benefit is not always that immediate.
Right, right. But in this
Sometimes
particular case, it was.
sometimes it takes a longer time. Sometimes it takes therapy and rehab. Um, but again, it all depends on how carefully selected the patients are.
Okay, cool. All right. So, ladies and gentlemen, I think that's going to be it. I apologize for the technical difficulties, but those things do happen. I think you know that in this particular world. I'm like on 5 different webinars a week, and at least one of them will have a situation like that. But thank you for bearing with us. Thank you, Doc, for coming back and getting this information to us and finalizing the story, because the closure would have killed me anyway. I was wondering how it happened.
No. We need to have the closure. So it's important.
Exactly. So, ladies and gentlemen, if you are looking for information about neck, spine, brain care, I want you to check out SymeonMissiosMD.com. That is the website of Dr. Symeon. I did it again. Dr. Symeon Missios MD.com. Right here on Long Island. He's at West Islip, but he's also, where's St. Catherine? Where is that? What town is that in?
Smithtown.
Smithtown, so not very far. Ladies and gents, if you're looking for a second opinion, you're looking for a doctor who will definitely make you feel a little bit more comfortable, this is the guy, because when I talk to him, I always feel like he'll give me the straight talk. All right. Doc, you have anything else you want to say to anybody?
No, thank you, Ryan, and thank you, everybody, for listening to us, and until we meet again.
All right, very well. Good night.
Good night.